Environmental practices. So, environmental management practices in a hospital, a clean environment plays an important role in prevention of hospital associated infection. Many factors, including the design of the patient care areas, operating rooms, air quality, water supply, laundry, okay, they all can significantly influence the transmission of hospital acquired infections. Okay, so all the areas of the hospital should be designed and should be maintained in such a way that it does not allow the transmission of healthcare associated infections. So that is the main challenge here. Page number 78 onwards. So when you talk about the premises or the buildings, okay, it should ensure adequate safe water supply. Potable water, non-potable water should be safe, fit for human use. Okay. Appropriate cleaning practices should be done twice or thrice as necessary. Spillage and everything is there. It has to be cleaned immediately by the housekeeping staff. Adequate floor space for the beds. It should not be too congested. Beds should not be too close to each other. It should not be too congested. Adequate interbed space should also be there. Okay. Adequate hand washing facilities wherever a patient care or patient contact is being anticipated. All in all such departments, hand washing facilities should be there. Facility designing and planning should ensure that adequate ventilation is given, okay, so that there is no cross contamination. Adequate isolation facilities. You have space where patients who come with H1N1 infections, airborne infections can be kept. Okay. Regulation of traffic, congestion of or too much of crowded places in the hospitals are prime spot. Okay, prime hotspots from where airborne infections as well as droplet or contact infections can spread. Okay, so the traffic within the hospital should be regulated wherever there is a high chance of traffic. For example, in the emergency department, reception area, radiology department, diagnosis centers, wherever you anticipate huge amount of people at all time. Okay, traffic regulation should be maintained here. Measures to prevent exposure in terms of using personal protective equipments like mask, gloves, gowns, goggles, face shields, hair caps, footwears, etc. Appropriate waste management facilities and practices based on the national level, international level, and local guidelines. Okay, waste management practices should be followed. In India, it is the Pollution Control Board as an authority. They maintain the rules and regulations regarding biomedical waste management. Next, you have heating, ventilation, and air conditioning. HVAC. HVAC stands for heating, ventilation, and air conditioning. So it is recommended to have minimum of 6 total air changes per room per hour, with 2 air changes per hour composed of outside air. What is this air changes? Air inside a room. Okay, air inside a room should be completely extracted and sent out 6 times in 1 hour. Okay, the air that is present in the room should not stay in the room for more than 1 hour. It should be changed 6 times in 1 hour. Okay, whatever is the right now, if you are in a room, if you have the air that you have in your room wherever you are, it has to change, it has to be pushed out. New air should come in. That air also should be pushed out. So 6 times within 1 hour, this pushing out should take place. And one time the air should be of outside air. That is the open air, the environment outside, the outside environment air should be there. Okay, otherwise usually the air from next room will come to this room, the air from bathrooms or toilets will come to the room, from your room it is going into the bathroom or toilets. Adjacent rooms are also supplying air to your room. Okay, but one air change should be of outside air. Okay, so that is the air, that is about air changes. And where air conditioning is not universal, at least 15 air changes per hour should be maintained in the patient areas, at least 3 per hour. Okay, when you have an air conditioner will take care of the 6 air changes. Okay, but when you don't have an air conditioner, you have to make sure at least 3 air changes per hour is taking place. When you switch on the ceiling fans, you can accomplish this. Keep the windows and doors open, switch on the ceiling fan. Okay, 3 air changes per hour will happen. Okay, it is recommended that all air should be filtered to a 99% efficiency. Okay, down to 5 microns. 5 microns, why? Because majority of the bacteria and viruses are of 5 microns in size, more or less. There are very few bacteria and viruses which are too tiny than 5 microns. Okay, so till 5 microns, if a system of an air conditioning or a filtration system is able to filter the air out up till 5 microns, it is well and more than enough. Okay, in critical care units, you will be having an enclosed patient modules. The temperature should be adjustable within each module. Okay, that allows the choice of temperatures from 16 to 25 degrees Celsius. Okay, that should be the temperature you should maintain within an ICU. Okay, protective environment. Here you can use HEPA filters. So HEPA filters are used to minimize airborne particles. Air must be circulated into the room with a velocity of at least 2.5 meter per second. That is the velocity of air wherever HEPA filter is placed. Okay. Particles with 0.3 microns diameter are also removed. So tiniest of bacteria and viruses can be removed from HEPA filter. Okay, the normal filters at least till 5 microns, if you are able to remove, the more than enough, but HEPA filter ensures that bacteria, dust, viruses that are of a diameter approximately around 0.3 microns, that is too tiny. Okay, can't see with naked eye at all. Okay, these tiny microns can also be removed by HEPA filter, and a clean and a free of bacteria air can be provided into the room by HEPA filter. HEPA filter, it stands for high efficiency particulate air. That is the full form of HEPA filter. Okay, you can see here a diagrammatic representation of how HEPA filter functions. Okay, so this is the room. Okay, the air that enters the room is green in color, which means HEPA filtered air, clean air. Okay, this blue air is room air. It could be clean, it could be contaminated. We can't be sure of. Okay. But room air will never reach the patient. Room air will be sucked out and it will be filtered. Okay. Room air and contaminated air will be sucked out. It will be filtered. Okay. And it will be cooled, filtered, and cooled, and then it will be sent back into the room. Okay. Filtered air can exit the HEPA filter also to maintain the equilibrium. Coming to the lighting used in wards, natural light as much as possible, how much ever possible you can access natural light, that is better. Natural light has healing properties, sunlight also has healing properties. So as much as possible and wherever possible, wherever you can access natural light, you have to access it. Light for procedures, high illumination and spotlighting is used. This is the spotlight you can see here on top. The top picture is of a spotlight. Okay, portable spotlights are also available in the ICU wherever some specific procedures are taking place. Portable spotlights can be used. The light required for general patient care, high frequency fluorescent lights and coated phosphorus lamps are used. This is the tube light, okay? Coated phosphorus lamps are the tube lights basically. So for general patient care, the light under a tube light is more than enough at night and all. But in daytime, as much as possible, access to natural light should be given. Noise control in the ICU, which is very important. According to the International Noise Control Agency, the noise control in ICU should be under, and in daytime, it should be under 45 dBA. Okay, 45 dBA, which means your watch and clock, okay, it ticks at around 40 dBA. It should, so that should be the amount of silence you should maintain inside a ICU during daytime. Okay, noise should be under 45 dBA. dBA stands for decibels, A weighted decibels. Okay, 40 dBA in the evening, 20 dBA at night. Okay, at night it should be the most quietest time. Even the sound should be less than of the clock ticking. Okay, a watch ticks at 20 dBA. A normal conversation that you do with in a normal sound range, it's about 55 dBA. Okay, a vacuum cleaner produces about 70 dBA. Okay, uh, a garbage disposal that makes a lot of noise, it's around 80 dBA. So you can understand how silent it should be in the ICU. Even your it should be quieter than your normal conversation. For hospital noise control, there are some areas, primary, secondary, tertiary areas from where you get majority of the noises, okay, in the hospital. Primary areas is reception, casualty, outpatient departments. These are the primary areas where you expect a lot of rush during the working hours of the hospital. These reception, outpatient departments, okay, there are working hours. Emergency doesn't have a working hours, but still these are the most crowded, and uh, you see a lot of traffic of people moving around in these departments. So these are the major noise sources in the hospital. The secondary areas are nursing stations within every ward, common patient wards, that is general patient wards, okay, diagnostic centers like laboratories and radiology departments, pharmacy department. Okay, these are where conversations will always take place. Okay, these departments depend on conversation. So these are the secondary areas from where noise emerges, okay, within a hospital. Then you have tertiary areas, parking lots, okay, laundry and linen center, canteen center. Indirectly they create a lot of noise. Okay, they don't create direct noise to disturb the patient, but laundry department, they generate a lot of noise. Parking lots as well, honking of the vehicles and all. Okay, canteens, the utensils, taking order, giving order, clanking of the utensils and all, they make a lot of noise. Okay, then the fourth factor is the location of the hospital and the infrastructure of the hospital. Where is it located? If it is in the center of the city, heart of the city, definitely noises will come around from the surroundings. Okay, if it is in a very secluded area, you will not see, you will find a much more serene environment in the hospital. Okay. Then the furnitures and furnishings, you have to make sure it has smooth surface, it does not have too much of decorative item, and make sure whatever furnishings you use for the hospital or you're buying for the hospital, majority of them, if it has wheels, furnitures on wheels, it is much more viable for the hospital's use. Okay, because you will have to transfer the patient a lot from one department to another. Instead of unloading and uploading the patients to wheelchairs, stretchers, trolleys. Okay, if you can directly shift the patient on their bed without touching the patient a lot, and prevention as a part of infection prevention. Okay, so having beds on wheels, trolleys on wheels, okay, tables, cardiac tables, drug tables, drug shelves on wheels, okay, screens on wheels. These would be much more beneficial. Even the chairs that are on wheels are much better and beneficial for hospitals. And it should have a smooth surface, because if because of some decorations and all, there are a lot of, if you find a lot of grooves in the furniture, over a period of time, dust and other grime, dirt and grime will accumulate, and it may turn out more hazardous for the infection prevention. Okay, so make sure the furnitures have a very smooth surface which can be cleaned easily by the housekeeping staff as a part of disinfection. Okay, and it should be sturdy furniture or made up of material which can at least last without any blemish, without any ditches. It can last for 10 years at least. When it comes to the flooring, make sure it is slip resistant. Okay, it has enough friction, slip resistant, fire resistant floors that you use in the hospital. It should be easy to clean, non slippery. Wheels should roll easily over the floors, so it should have a little bit of friction but not more. Okay, petrified, non-petrified tiles, non-slippery tiles can be used. Petrified tiles, non-slippery ones can be used, or else you can go for this vinyl sheeting, which you see here in the image, vinyl sheeting. Okay, so that is also a very viable option. It gives a really good aesthetic to the hospital environment, but and this is fire resistant as well, vinyl sheetings. But if it starts to tear from one end, okay, from one end, if it starts to tear, it will tear up. Okay, it will keep on tearing up till the end. Okay, one small tear is enough to destroy the entire vinyl sheeting. From one end it will start to tear, and that tear will go straight to the other end. Okay, so to keep the upkeep of the vinyl sheeting, you have to be bit careful. Then coming to the walls, durability, durable walls should be used. The paint and all, it should not chip very often. Good quality paint should be used. Ability to clean and maintain should be easy. If you have tiles on wall, it is much more easier. Okay, tiles would be flame resistant, stain resistant, mildew resistant. Mildew is like, you must have seen if there is any leakage, water leakage through the walls. The color of the wall changes. It becomes grayish, blackish. Okay, black spots will appear wherever there is a leakage in the wall. Okay, that is mildew. Okay, sound absorption should be there so that it gives serene environment for the patients to heal. And visual appeal, it should be not of bright colors, not colors not coming at you. Okay, colors should like fade away and give a serene quality, like blues, hues of blues, aquamarine, greens, beige, okay, light colors, okay, which soothes the eye. And the height up to 4 to 5 feet, you can use tiles. Okay, so it will not stain the walls. If any body fluid spill, blood spill, any drug spill is anticipated, it is cleaned easily. Okay, and then ceiling, soiling and breakthrough sealing should be there. Okay, there should be no leakage and any condensation over the ceiling. Tiled ceiling will give a much better appearance. On this image, you can see this is an image of a tiled ceiling. So all the wiring and everything is inside. You will not see any wires going from one point to another point on the ceiling. It just gives you light, and tile effect is there. It enhances the visual appeal of the room. It is recommended that no lines or wires should be kept run over the ceiling. Okay, uh, cut wires and all, it should not be there, because it can affect the patient care. If the patient touches it by mistake, okay, it falls on the patient by mistake, it could give electric current. Okay, so unkept wires should not be accessible at all into the room. It should be tucked inside the ceiling tiles. Then water disposal and pollution control, make sure what are the natural water resources you have near your hospital building, and make sure the hospital waste, sewage waste, water waste are treated before it is being dumped into the natural resources. Okay, if your hospital waste are directly dumped into the natural resources, it could be a very major source of pathological infection for the entire community. Okay, so be careful about how you treat your water waste and sewage waste from the hospital. Then you have disaster preparedness. Okay, a disaster plan. So first step is plan a response for every kind of disaster that commonly takes place in the geographical location where the hospital is. Every geographical location is prone to different kind of disasters. Okay, so you should plan a response first. Okay, second is organize and equip. Make sure uh, you, for example, if it is fire extinguishers, okay, if it is a disaster management preparedness for fire safety, fire hazards, make sure you have enough fire water hose, sprinklers, smoke detectors, fire extinguishers. Okay, your hospital physical facility is well equipped with items that can act as savior during the disaster. Okay, train the personals. Every 3 months, 4 months, mock drill should be conducted for each and every department. Okay, give them visual training, physical training as well. Okay, exercise incidents, that is the mock drill. Whenever you conduct mock drills, it means you are in the plan 4 of exercising incidents. Okay, and then evaluate. Fifth step is evaluate. Whenever you do mock drills in the hospital, you come up with an after plan, because in mock drills the leader understands where and all things are going wrong, where and all people are still not getting the point. Okay, so you can evaluate and improve those areas for the next time. Okay, so this comes under disaster preparedness. Cleaning of the hospital environment, administrative and office areas, normal domestic cleaning, the cleaning that you do at home, the same type of cleaning you can do in the administrative and office area where patient care is not given. Okay, patients don't go in the administrative and office area, so regular housekeeping can be done. Most patient care areas, wet mopping should be done. Don't do the dry mopping. Dry dusting should not be done, because when you do dry dusting or dry mopping, like when you use brooming techniques, when it is used, you will dispel more dust, which can be carrying microbes into the air. Okay, and it will transmit more infection. So directly go for wet mopping. No need to dry mop or dry dust. The use of neutral detergent solution is important because it will not tarnish the floor. It will not be too harsh for the surfaces, metal surfaces as well. Hot water, 80 degrees Celsius, is also an effective solvent. So if you're using detergent, if you're using disinfectant, instead of putting it on cold water, use 80 degrees Celsius hot water. Okay, it can work as a much better cleaning agent than cold water with detergent, soap, or disinfectants. Bacteriological testing of the environment on a regular basis is not recommended. It is only done in a during outbreaks, but it is better from a quality point of view. It is better to do the bacteriological testing of the environment on a monthly basis, especially for OTs and all. Okay, the air vents of the OT, the floor of the OT table, every nook and corner of the OT. Once a month, do the bacteriological testing of these areas to find out if there is any severe pathogens which are susceptible or a potential outbreak causes. Contaminated with blood and body fluid, these equipments should be cleaned immediately with detergent and water. Isolation rooms should be cleaned with detergent or disinfectant solution at least twice daily. Okay, every day, twice a day, isolation rooms should be cleaned. All horizontal surfaces where you walk, okay, and toilet areas should be cleaned daily. Okay, all horizontal surfaces like staircases, corridors, floors, toilet areas, sitting areas, okay, they should be cleaned daily. So that's about environmental practices. If you have any queries, you can mention in the chat box. Thank you all. That's all for today.